lecture 16, which is oral surgery. Oral surgery is the specialty involved with removing teeth, treating jaw fractures, TMJ repair, bone and tissue grafts, removal of tumors and cysts, reconstruction of oral and dental deformities, and treatment of traumatic injuries. Extodontics is a term that is used to describe the extraction of teeth. Informed consent is permission that is given from the patient or the patient's parent or guardian after all the possible risks and complications of the upcoming treatment have been explained. You'll want to review the patient's medical history, and reviewing the medical history is imperative prior to any surgical procedure. Special precautions may be necessary if the patient reports any of the following conditions. We'll start with heart attack. If a heart attack was suffered within the last 6 months, you'll want to consult the patient's cardiologist or their general physician. You may need to take precautionary measures such as decreasing or eliminating epinephrine. If a patient has a heart murmur, it is sometimes necessary to have the patient pre-medicate with antibiotics prior to oral surgery procedures, depending on what kind of heart murmur they may have. If a patient has joint or heart valve replacement, these procedures, if they have been performed within the last 2 years, pre-medication with antibiotics may be indicated by the patient's physician. If a patient is an insulin-dependent diabetic, it is recommended that the patient have a meal prior to any extended oral surgery procedure. If the patient has hypertension, it is recommended that the diastolic reading is below 100 in order to perform oral surgery. Risk of stroke or heart attack increases if the patient does not have controlled blood pressure. So prior to any sort of oral surgery procedure, you always want to take blood pressure just to make sure everything is in order. If the patient has kidney or liver disease, increased bleeding time may occur. So caution is also recommended when prescribing medication to these patients because certain medications can be very taxing on the kidney or the liver. If a patient is pregnant, oral surgery should be avoided absolutely during the first trimester and only on an emergency basis for the last 2 trimesters. All current medications should be gone over prior to oral surgery. Interactions with pain medication and local anesthetic with the patient's current medications can put the patient at risk. Possible interactions should be investigated prior to prescription and treatment. Some oral surgery terms and procedures are impacted teeth. So we've got soft tissue impaction and full bony impaction. Soft tissue impaction is when the tooth is fully or partially covered by gum tissue, and full bony impaction is when the tooth is completely covered by bone. A frenectomy is the surgical procedure used to remove the lingual or facial frenum attachment. This procedure can help close the diastema and increase mobility to the lip or the tongue. Also, you should know that a diastema is the space between 2 teeth. Alveoplasty is the removal of bone with a high-speed handpiece and a surgical burr. Alveolitis is also known as dry socket. It is the absence of a blood clot in the socket following an extraction. A very painful occurrence which can be attributed to vigorous swishing, spitting, or smoking following an extraction. And the biopsy is a removal of a sample of irregular tissue and to be sent to a lab for analysis.